In this video, we'll be looking at what should be done to prevent diabetes in pregnancy. Diabetes is a chronic disease that is caused by a malfunctioning of the insulin-producing cells in the body. This condition can be triggered by various factors, such as excessive intake of sugary foods, obesity, chronic high stress, lack of physical activity, excessive alcohol intake, tobacco use, lack of proper diet and bad eating habits. Please subscribe to our channel, if you haven't already. Get instant notifications of our future videos, by clicking the bell icon. Thank you. These factors often lead to accumulation of fat deposits around the waistline of the mother's womb, which increases her risk of having diabetes. There is a possibility that the baby will get diabetes if the mother also has the disease. The best way to prevent diabetes in pregnancy is to avoid the risk factors mentioned above. Pregnant women need to control their weight, as a large amount of weight gain can cause a variety of serious medical conditions such as ectopic pregnancy, gestational diabetes, stillbirth or fetal abnormalities, heart problems and mental retardation. Even though you may not know it, your health condition is always in your control, because you choose how to live your life. So how to prevent diabetes in pregnancy? Here are some ways. 1. Change your diet. Women are generally advised to eat a balanced diet during pregnancy. Now this means making sure you have a varied diet rather than eating a lot of the same type of food, so the baby gets all the needed nutrients. Most women can simply trust their appetite and don't need to follow a special diet. The only women who can benefit from dietary changes are those who are overweight or obese. They can lower their risk of diabetes by changing their diet, with the help of a professional nutritionist or dietitian. The dietary changes can reduce their blood sugar levels, thus helping them put on less weight in pregnancy. In women who have a normal weight, dietary changes don't have a preventive effect. 2. Monitor your weight gain during pregnancy. Some women who gain a lot of weight in pregnancy do have a higher risk of certain health problems and complications during childbirth. Putting on a lot of weight can be a sign of diabetes. There are some official recommendations concerning how much weight pregnant women should gain. Now this depends on how much they weighed beforehand. For women who were underweight before pregnancy, it can be between 12 and 18 kilograms of weight gain during pregnancy. For women who had a normal weight before pregnancy, it can be between 11 and 16 kilograms of weight gain during pregnancy. For women who were overweight before pregnancy, it can be between 7 and 12 kilograms of weight gain during pregnancy. For women who were obese before pregnancy, it can be between 5 and 10 kilograms of weight gain during pregnancy. 3. Exercise. Exercise is another key component of a healthy diet. Even if you are not planning to exercise while pregnant, it is important to exercise regularly to maintain healthy blood sugar levels. For this purpose, you should take short walks during the day. It is also recommended that you get your daily exercise in when you are not ovulating. This is because, as you know, exercise during pregnancy can be difficult for most women. 4. Try to keep the carbs and sugar in control. As you may be aware, because carbohydrates increase one's blood sugar levels, most people are advised to cut down on carbohydrates, while making sure they still get enough fiber, and generally eat a balanced diet otherwise. Other common advice usually includes eating 3 not too big main meals, and 2 to 3 smaller meals per day. The exact dietary changes to be made will depend on things like how much the woman weighs, and how much exercise she gets. Getting special advice from a qualified nutritionist or dietitian does help to avoid adverse effects. It's important to make sure that your body gets enough calories and certain nutrients in pregnancy. So it isn't a good idea to go on a reduced calorie diet while pregnant. 5. Take supplements during pregnancy. It's usually good to take some supplements of common deficiencies like iron, vitamin D, etc. Dietary supplements containing myo-inositol might reduce the risk of diabetes. One possible explanation for this potential effect is that myo-inositol can make insulin work better. But it's not clear whether taking myo-inositol supplements can also reduce the risk of the possible consequences of diabetes, such as complications during birth. Some studies have shown maternal vitamin D deficiency, as early as the first trimester of pregnancy, is associated with an increased risk for diabetes. But it's not clear whether taking vitamin D supplements has a preventive effect. Certain dietary supplements, such as omega-3 fatty acids, also known as fish oil, are sometimes claimed to help prevent diabetes. Learning how to prevent diabetes in pregnancy can be challenging. However, with the right information and your doctor's advice, you can learn what foods to avoid, as well as which foods are beneficial to your health. You should also practice a healthy lifestyle by being sure to get enough rest and eating a well-balanced diet. Your goal should be to have your weight gain under control, as well as your cholesterol level. If you are already at a healthy weight, and your doctor has advised you to start an exercise program, follow his or her guidelines. In addition, you should also get exercise regularly to strengthen your muscles. If you enjoyed this video, please hit the like button and subscribe to our channel. Thank you.